This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
But nice to meet you, everyone. My name is Jordan Peterson. I'm from Corewell Health Taylor. We were previously called Beaumont Health. Before that, we were Wayne State. So a couple name changes, but same location, and the residency has been going strong. Let me see. There we go. So we're just going to talk a little bit about the program, make sure we can give you a little bit of information while you're researching programs, and hopefully spark some interest in the program. We'll go through our program leadership. This is our department chair, Dr. Mendez. Very, very strong MSK background, and really great leader to have around. Guides the ship and keeps us in line with everything we need to learn, and making sure that we have a good base and foundation in our program. Here's our program directors. We have Dr. Ho and Dr. Mafia. Many of our attendings and faculty came from the program itself. Dr. Ho went to University of Michigan, but did his intern year here with Corewell, or I guess Beaumont at the time. This is Dr. Smith. He's our brain injury specialist. We have another fellowship trained brain injury attending, but he is the program director for the fellowship. It's the only one in Michigan. And Dr. Roskas, he's our neuropsychologist. We get to rotate it with him through neuropsychology, but he's also very closely involved in our research, and gets us to all of the events and helps us with our research interests. So the mission, we hope to enhance the quality and meaning of life in our diverse multicultural community by providing extraordinary evidence-based compassionate rehabilitation care. We're going to further the field of PM&R through educating medical students, residents, fellows, and through this immersive training, strive to become a premier clinical training program in PM&R. A few things about us. We have 5 residents every year. We are we have our intern groups here with us. So similar to other programs, very much involved with the medicine and the TYs, but they do get to come to our weekly didactics, and so they get a feel for the program and get to know everyone in the faculty a little bit early on, while still getting the training throughout our system, and kind of get familiar with the whole EMR and the way things are run before you even hit the rehab floor. So it's very nice. We have a brain injury medicine fellowship with Dr. Smith, like Ed mentioned. Our main home base, this is our rehab hospital. It does have an ICU and IMC floor, as well as a med-surg floor. It does have a lot of orthopedics in there, so we're closely involved with the orthopedics team that's based out of here. Very multicultural population that we serve in the area. 49-bed unit, and we have a designated traumatic brain injury or neurotrauma unit that is 14 of those 49 beds. So up at the top there, we rotate through mostly. We're at Taylor the very most. This is where you spend most of the time, especially in second year on the rehab floor. The top one, that's our main campus in our hospital system, at least this formerly Beaumont system. That's in Dearborn. The next one's there in Trenton, the middle picture. And then the bottom one is in Wayne. So we spend most of our time at Taylor and then Dearborn with some consultation rotations through Trenton and Wayne as well. In our first, here's just a little outline of what our rotations look like. That first year, I really think it's a very valuable year for our program. We get a very strong base in medicine and become very, comfortable in a lot of management that's going to end up on the rehab floor in the first place. We get to work with some amazing physicians and the internal medicine residents and radiology, ophthalmology, a lot of other residents that we build connections with that become really good sources of, consultation and people that we talk to throughout the rest of the years. I really liked that first year because it kind of got us, kind of got me in connection with a lot of the people that I was going to be talking to in that PGY 2 year. Our PGY 2 year is very inpatient heavy. We have 9 inpatient months with 2 consult months and then a neuropsychology month with Dr. Roskus that I had mentioned. PGY 3, we start getting a little bit more into the outpatient setting and working with orthopedics and neurosurgery and pediatrics. And then the 4th year kind of winds down a little bit, finish up inpatient and lots of outpatient consultation, and whatever elective and interest that you're wanting to pursue, we get those electives as well. Some of the perks, there's 20 vacation days every year. We get 5 vacation or conference days as well. They've kind of been adjusting the conference reimbursement, but in a good way. There, if you present and you are a first author, things like that, they help pay for the trip and a lot of the things associated with that. Right there, it says we have 7 interview days that are designated just for any interviews. I think we actually are in the process of increasing that as well, giving opportunities if you do want fellowships, or if you're going into general, it gives you the opportunity to go check out the locations that you're interested in going in. Some of the benefits, PGY 1, we get the $800 and then a $1,200 through the next couple years for educational stipend. We have an $1,800 food stipend every year. There is food in the resident lounge. You can do the $1,800 on a card that's good at the hospitals, or you can have it directly deposited into your check. You do get subscriptions to the journals. We do have a lift service if for whatever reason, if you're feeling fatigued or it just wasn't the right day, they'll pay for your lift home and back to work the next day if your car is already there. So it's a nice little perk that we have. I did look up, we had a change in our, let me see, in our salaries just this past year. Currently our PGY 1s, it's about 64,700, and by the time you're PGY 4, it goes up to 71,400. So other than that, Bashar, are you on the call?
Yeah, I am.
All right, I'm gonna let Bashar talk a little bit about the next bit, and I'll kind of look through the chat box if there's any questions while we're going along.
Hello, everyone. I'm Bashar. I'm one of the PGY4s. I'm the academic chief resident in Corewell Taylor, and I'm usually in charge of the didactics for this year. And typically, we have them on Thursdays from 12:30 p.m. to 3:30. we try to incorporate as much learning that's tailored mainly towards the AB PM&R outline. Also, we incorporate like board review topics and questionnaires that we get either from old SAE questions or we get from attendings. They make up certain questions that's on the way. Other than that, the PGY2s, they usually present M&Ms and along with journal clubs and case reports. And for PGY3s, they do one journal club and one case report. And for PGY4s, we usually do a QI project and grand rounds that we pick a topic on. Other than that, we do have a mock oral board reviews for the PGY4s. That's usually typically done during the second half of the year, closer towards the boards, about like 3 to 4 months before August. That's when we typically have our mock oral boards. And we do have workshops that are attendings and that we work closely with either sports physicians that or either radiology that we do ultrasound workshops and EMG workshops.
Fine.
And most of our residents who end up going to fellowship, they usually match into pretty good fellowships at their desired locations. And in the distinguished fellowship, there's a full list of places that they matched on, and usually all of them, they usually get their first choice. The most recent one last year, they got into Baylor in brain injury medicine and UCLA in pain medicine. And we've incorporated, or the program has incorporated that we have to do a QI project during our 4th year. So, why Corewell Health Taylor? It's we're usually 5 per class and 20 for the 4 years. We're usually very close. We always do a lot of activities. We have camaraderie between each other. We're always keen to set up activities outside of work. We're all in touch with each other. Even with our graduates and alumni, they always reach out to us. And whenever anyone's in town, we make a big outing and we always go out. And also the attendings are really involved with any of the outings. They always aim to set up an outing so we can go out, and they invite us for dinner, which is always nice. And for example, Dr. Ho would invite us to go golfing, and he's our program director. He makes a day out with me, go golfing, and then we go on the lake where we sit on the boat and try to fish for fish. And Jordan can speak more about fishing. He's usually he's really into fishing. And so fun things to do in Metro Detroit and Michigan. There's a bunch of stuff where, first of all, that's where we're located in. It's in Taylor, right? Yeah, that's where the arrow is. And one of the hospitals is in Dearborn, and that's where we do our consultation. And a little bit further south is the 3rd hospital. It's in Trenton. It's about like 20-minute drive from Dearborn, but everywhere from Taylor or Mayor Hospital is 15 minutes across the board, which is not too bad. And yeah, so sports teams. So we're doing pretty good on sports so far, from what I understand. We have the Lions, the football team. They're doing pretty well. They did pretty well last year, and hopefully they'll do well this year. We have a basketball team, we have a hockey team, and a baseball team. And that's the time when Dr. Ho took us out for golfing. And so during the winter, we have a bunch of sport activities where you can go snowmobile or snowboarding, or just walk around the icy lake. And Metro Detroit is known for its diversity of food, whether it's Arabic food, which is really big in Dearborn, but it has a good range and wide variety of food, and it's really, really good. Everyone seems to be enjoying it. And on the bottom left is our program director, Dr. Ho, eating food with his son. And you can also there's the Fox Theater in Detroit where they have some shows, comedy shows, and other concerts that happen over there. And you have the Henry Ford Museum, which is it's one of the attractions, and it's in Dearborn, which is one of the attractions in Detroit. And in Traverse City, it's up north where you have the National Cherry Festival. And that's the Upper Peninsula. One thing is the Riverwalk, which is in downtown Detroit. There's a lot of activities, whether it's in the fall, winter, spring, or summer. It's really nice to go over there. On the other side, you do see Canada, Windsor, Ontario over there. And in the winter, they make an ice rink around it and inside of it, and that's where you can go ice skating, and you can around the Christmas tree. And if you drive a little bit further north, it's about maybe 6, 7 hours. You reach the Upper Peninsula. It's really, really beautiful. You have cliffs, bridges, and waterfalls. And in the fall, it's beautiful over there. Yep.
Sorry about that. I started clicking through. I didn't know if more animations were coming up, but there's a lot to do in the area. You get a really good, strong education, get a very good clinical experience, and you have a lot of things to do in the meantime with fun. There's sports for everyone. There's theaters, there's shows, there's pretty much anything you can think of. And you know, as you kind of go through the program, you have you know, time to explore and enjoy life while you're getting educated as well. So there was a question in the chat about any US IMGs in the past or currently. The answer is yes. We do have in our group, I think we have in our class, I think there's a couple, but there's usually some in every class that I think maybe not this most recent year, but I think every other class has a US IMG and other IMGs as well. Let's see, for those applying this cycle, when reviewing application, what are the most important to the programs? Letters of recommendation, personal statement, MSP. Okay, so that's a good question. For, you know, a lot of it, it's just we haven't been on that side of the interview process. From what I've heard from the attendings, you know, it's kind of maybe it's the tougher answer. It's a lot of different things. I wouldn't necessarily say one thing is more important than the other. I think if you get good, strong letters of recommendation, they take your whole application into consideration. And frequently they just want to make sure you're a good fit for the program, you know, and make sure that you're going to, it's the right place for you as well. As far as the interview format, I think we are in line with whatever, I think as far as my understanding as of now, it's going to be virtual. But we will, you know, make that known if that changes. Let's see.
One thing I want to add is that the most important thing is the rotations that you do during your final year is just to show that you're interested. And I think that's the biggest thing that I think our program is mainly looking for is the program director really wants to know that you're really invested in the field of PM&R and not just backing up PM&R as to other specialties.
That's fair. Hands-on experience. How are the hands-on experience like in your program? I think we have a good variety of everything. There's a lot of clinical outpatient things. We get plenty of procedures, injections, baclofen pumps, spasticity management, EMGs, high volume with pain rotations is when you do the pain rotations. high volumes of bread and butter and some exposure to some of the advanced procedures. I think last year I was able to be in with like a mild and intercept and spinal cord stimulator trials and some permanent ones as well. So lots of exposure to, you know, pretty much anything that you are interested in. We have our program directors. Each attending kind of has their own little area that they enjoy more and they're a little more focused on. So we have lots of EMG, or a couple EMG focused attendings. We have our prosthetics, orthotics, and amputations clinic. We have a lot of brain injury patients where we see, you know, every kind of trauma there is, and get to interact and work with those patients and spinal cord injuries. So it's a wide breadth for your experience. As far as program having opportunities for OMM, there's nothing official that's part of it. One of our graduating, I think it was from last year, it might have been the year before that. They had a special interest in it, and so in their I think they might have been able to do a rotation that was involved with that, and then they actually had some clinic patients that were waiting until they were in clinic, and they had the opportunity to do some OMM in there as well. There have been some of my colleagues as well that ask some of us, other DOs like myself, if there is, you know, any interest, and we've done that informally in the lecture halls with just the colleagues and work on some things. But it really is dependent on others' interest, but nothing formal, but plenty of opportunity if it's something that you want to continue with. Let's see, the next question in the chat. The experiences like during surgery rotations, are they mostly OR outpatient? Neurosurgery, there's a lot of opportunity to be in the OR. I think that's about half and half with neurosurgery, depending on your interest. Sometimes if you are much more clinical and you've been there for like the week and you've seen, you know, the same thing several times, they may let you do extra time in the clinic. But if you are really interested, they're certainly going to provide those opportunities for you to scrub in and or observe. I thought it was really beneficial having a little bit better understanding of the patients we were treating on rehab, and then just getting, you know, a little bit more comfortable with the anatomy of what they're working with. So the neurosurgery rotations, there's plenty of surgery opportunities, but if it's really not your thing, they can get you in the clinic a little more frequently. Ortho is clinical, outpatient, and lots of MSK. They have an after hours clinic where you can go with the other residents if some, you know, sports or sports and spine is more of your interest. It gives some opportunities to something to put on applications as well as learning a little bit more about casting, some of the bracing that they do, and getting a feel for which injuries they're seeing they, you know, deem surgical or not surgical, and really gives good experience on that as well.